Hello everyone, we are Scott AGS Hospital Doctors. I am Win and my partner is Hưng. So today we're gonna explore the CT technology, computer aid technology. For the content, I will explicitly explain to you what is CT, how it works and its components. Hưng will dive deep into some complex technologies, for instance, how it can detect cancers, and the most crucial things, its pros and cons. What is CT? CT scanners are a type of medical imaging that is depicted to be simply a rotating X-ray tube. The following can help to get a better view of the patient's internal body organs such as head, neck, lungs, abdomen instead of bones, like X-rays. There are four main components of the CT, which are gantry, X-ray tubes, photon detectors, and finally X-ray shooting elements. The gantry is a donut-shaped compartment which contains the X-ray and the receivers of the X-ray. The X-ray tubes is contained within the gantry where it will rotate rapidly making slices picturing the body. The photon detectors, this component is also contained inside the gantry which rotates simultaneously with the X-ray tubes and receives the X-rays when they are complete the slide. The X-ray shielding elements is when the X-ray interacts with the patient's cell. This causes the X-ray to be spread out, which causes risk due to radiation exposure. The shielding elements are materials that can absorb these radiations. Here's the examples of CT imaging which you can see the brains, the organs, or the bones. These two pictures will show you how the CT scanner looks like. In picture 2, you can clearly see that the X-ray source shines the objects, and the rotation table will rotate the objects 360 degrees so that the detector can sense and result in CT pictures.
So thank you, Dr. Nguyen, for explaining how CT basically works and the general mechanism of it. I'm going to be delving into further how CT will interact with our patients. So basically, in the gantry, which is in the donut-shaped part right here, you can see there is two main components, which Dr. Nguyen has taught and touched slightly on, being the X-ray tube and the photon receivers. In basic term, what this do is it's gonna the X-ray tube will shoot out the X-ray, and after it shoots out the X-ray, it's gonna go through your body, and this is proportional to the density of your internal organs, basically. So using that, the density, it's gonna pass through the receivers, and it's gonna using the computer inside the CT scan, it will create an image of what your internal body pretty much looks like. So using that information, we can move on to how does it detect dangerous stuff, for example, cancer with here. So you can have a look at the normal brain. It looks, uh, you can see the density of the brain. It passes through and the receiver, and boom, you got a normal brain. But you can see with the brain with tumor, because of the density of the tumor is different to the density of the surrounding, when the X-ray specifically passes through the brain, you can see there's like a little color differentiation. You can see this one being a much more lighter, opaque, than the overall area of the brain. You can see the same situation happening over the lungs here. So you can see you got no more lung right here. But if we move on to a lung with cancer, you can see there's like a big black dot because the density of the tumor inside your lungs, it blocks the X-ray. So the photon receiver uh, can realize that, and it processes out the imaging, and it looks like there's a big black dot right there. So basically, that's how it detects cancer and dangerous tumors inside your body. So with anything, there are benefits and limitations. So basically, the benefit of CT is it's really clear imaging. You can really see the cancer or the tumor of any dangerous diseases. And the limitation is it can take long, right? There's like a lot of long-term preparation sometimes, and it takes 15 minutes for a complete scan. And sometimes we have to inject something into you to have a clearer picture or swallow, depending on the area that we're scanning. And those are the few. And also the limitation is you are exposed to radiation, only a little bit though, which can be a bit risky and dangerous. But we do have receivers, which Ween has explained. So yeah. Anyways, thank you very much for our patience for listening in to the basic concept of how CT basically works.